So my name is Gabriel Siebiger. I'm an MD from Brazil originally, and I'm currently doing a Master of Science at the Institute of Medical Science with Dr. Marcelo Saipel, focusing on thoracic surgery and lung transplantation. And I'm currently pursuing a project called mitochondrial transplantation.
Could you share a current project or study you're excited about?
So a current project I'm working on that I'm pretty excited about is called mitochondrial transplantation. So it's a novel technique that allows us to transplant these organelles, which are known as a powerhouse of the cell, into the lungs as an intervention. So this is a technique that was developed very recently, considering the span of research we work on, in 2008 in another lab, and we're currently employing on ex vivo lung perfusion, which is a platform that allows us to examine lungs out of the body prior to transplantation. That's currently done clinically here in Toronto. It was developed here by my mentor, Dr. Saipel, so it's pretty exciting to be in the birthplace of the technique. And also Toronto is the birthplace of lung transplantation itself, so it's pretty exciting to be at the home institution in which everything is happening.
What kind of impact are you hoping that this research can have?
The impact I'm hoping it will have is currently I'm part of the ex vivo lung perfusion team at the Toronto General Hospital. What that technique allows us to do is examine and assess lungs which would normally not be accepted for transplantation, and see if they could be potentially effective ex vivo out of the body in a technique that allows us to estimate how the lung function would be after implantation in a patient. Some of these lungs, however, they are very injured. And the idea is that with mitochondrial transplantation, we can recover part of these lungs that would normally never be transplanted, and then reach out to other patients that are not being reached with the current transplantation techniques.
What is the best part of being a graduate student in Temerty Medicine?
I think the best part of being a graduate student at Temerty Medicine is the collaborative environment in which we're currently inserted. So my mentor, Dr. Saipel, is a specialist in lung transplantation and surgery. As part of my program advisory committee, I have Dr. Andreasa, which is a Canada Research Chair in mitochondrial research. So Dr. Saipel can bring the thoracic transplantation expertise and the ex vivo transplantation technique. I have Dr. Andreasa to bring the mitochondrial research perspective. And I have other mentors which are specialists in their specific fields. And I think this collaborative nature is very unique to Toronto. In addition to that, we also have partnerships with industry. So if in the future we want to translate those discoveries to patients and bring it from bench to bedside effectively, we also have the condition to do so.
Outside of school, what are your hobbies or interests?
Outside of school, I like to bike a lot. This is something that became a trend in our lab. Dr. Saipel bikes himself. So we have a group, and every single year we do an annual challenge biking to Niagara. So it's a 140 kilometers ride, something I've never done before. So I learned to do that with the lab. And apart from that, we also have a very strong tradition of Brazilian barbecue, which we're bringing from Brazil to here.
What's something surprising that people might not know about you?
I think something surprising people might not know about me is that I played violin when I was a kid, and my wife is currently about to start the cello performance program at U of T this September. So we both like to play together, and that's something I think most people would not know.
If you could have dinner with any person, past or present, who would it be and why?
If I could have dinner with any person of my choosing, at the moment, I'd like to have a dinner with Dr. Cooper, who brought the first transplant into fruition here in Toronto in the 80s, and see how his experience was in detail.
Backpacking adventure or luxury resort vacation?
Backpacking adventure for sure.
Coffee or tea?
Coffee.
Pineapple on pizza? Yes or no?
Yes. Surprisingly, yes.
Dogs or cats?
Tough one. I've always had dogs, now I have a cat, so I would say cat for now. Yes.
Fiction or non-fiction books?
Non-fiction.
Early bird or night owl?
Night owl.
Sweet or savory?
Savory.
Summer or winter?
Summer.
Comedy or drama movies?
Drama.
Thank you very much, Gabriel, for coming in today.
My pleasure. Thank you.